It is summertime, which normally means summer vacations. Of course, coronavirus is changing how we look at spending time together and going on trips. In today's To Your Well-Being, we are talking safe summer travels during COVID-19. So Cone Health's Wesley Long Hospital Chief Medical Officer, Dr. Jeffrey Hatcher, is joining us. Thank you for joining us. All right, let's get right to these questions. The first one is, are masks and social distancing recommended while we're vacationing, even when we're on the beach?
So masks and social distancing are still recommended. I think that if you're in areas where you will be in close contact with other people, I would absolutely recommend them. If you're on the beach, it would depend on how close you're going to be to other people. So if you were with your family unit on the beach, and that is people you live with and you're usually around, then you might forego wearing a mask and you're going to be close to those people. But once you are away from those people, I would suggest keeping your distance and wearing a mask.
Easy enough. So what about if you're staying with extended family, like all in one place, one house? A lot of families do that. They've got cousins and people coming from all over, that kind of stuff. How do you keep yourself safe in that instance?
Yeah, that is tricky. I think one of the recommendations around that would be that, let's say that my family is going to meet my in-laws' family at the beach, would be before we both go to the beach, that we are both sort of staying at home as much as we can for those 2 weeks before the beach and quarantining ourselves as best we can. And then when we're together, again, keeping our distance as much as we can and hand washing as much as we can. And then just trying to make good choices while we're there together, which would be wearing masks when we're out of the house and away from people who we're not sharing space with.
Okay, so I really like that idea of everybody kind of quarantines themselves before they go on vacation. That way they know when they get together that everybody is probably okay and they're able to spend time in closer proximity being okay. All right, so if for some reason, let's say you do have those people coming in and out, that kind of thing with different family members and that kind of stuff, do you recommend wearing a mask inside the house?
I would only wear a mask in the house if somebody was in the house who I really wasn't used to being or wasn't in my social circle, right? So if it wasn't somebody who I was around or who I could sort of account for in terms of where they had been or who they had been around, then I would probably be a little more cautious.
Okay, but if it's going to be the family members that you know everybody's been staying home and not being with other people, then this is probably an okay thing without a mask. All right, how about any special recommendations for shared spaces like kitchens, bathrooms, living rooms?
So, typically you'd suggest, wiping down common surfaces and keeping them clean. Again, lots of good hand washing. And then outside of that, there's not a lot of other things to do. There's been a lot of debate in the medical community about how long this virus can live on inanimate surfaces. There have been some papers published early on that saying that the virus could live for 2 or 3 days on inanimate surfaces. But those studies were done in very controlled environments that controlled temperature and humidity. Outside of those types of environments, we're not really sure how long the virus lives on inanimate surfaces. We know that it's very sensitive to heat, it's very sensitive to changes in humidity, and it's very sensitive to sunlight.
Okay, so there's going to be a lot of people who they rent the beach condo and they're going to stay by themselves, that kind of thing. But then what they're going to do is they're going to go to the pool because that's where, you go. So pools are opening up, vacation spots that have pools are open. What are your recommendations for reducing exposure?
So I can tell you what we've done at our pool, which is there is a limited number of people who are allowed to go to the pool at any one time. There's a reservation system. You wash your hands when you go in. The deck chairs on the pool are spaced out. The grill has very limited service, if any service at all. And again, you're keeping your distance. I'm spending my time with my family members when I'm at the pool. But aside from that, if I want to visit with my friends when I'm at the pool, I'm keeping at least 6 feet away from them. And again, lots of good hand washing.
Okay.
We don't think that this virus. Go ahead.
Go ahead. You don't think the virus spreads as easily, like in the pool with all of the chlorine and all that?
Right. We don't think of this virus as something that's transmissible through pool water. So that part of it we don't worry about.
And that is something that is going to be very comforting for people because they want to go to the splash pools or whatever else for the cities or counties as well. Even if they're not going on vacation, they're going to be in their hometown pool. All right, so what should we do if we're traveling with someone and then someone gets sick while we are away from home?
So I would advise you to seek medical care. So take an assessment of how sick you are, what kind of sickness you have, and then to seek medical care.
Okay, and so don't wait till you get home. Seek medical care while you're there.
Yes.